But let me just give you a quick run of show what will happen today for our briefing. Pretty much we're giving you the first 48-hour snapshot, what things look like so far. Commissioner Squires will give a rundown from public safety with also Chief Brown on what some of the core activities and numbers and statistics that have come out of the first 48 hours. Today also started the first day of cleanup with the operation, and we have Gary Edwards with the Salt Lake County Department of Health. They'll provide an update on what took place today. After that, we'll open up to question and answers, and we'll go from there.
Good afternoon, Keith Squires, Commissioner, Utah Department of Public Safety. I'll just update you from the time we got together yesterday and letting you know that all of the agencies involved are in close communication and coordination. We have mobile command centers located down in the area, as well as policy conference calls and meetings that are taking place between the agency administrators on a regular basis. We continue to feel that things are progressing as planned. I can report to you today that we've had to date, this is based on the two-day operations ending yesterday, a total of 87 arrests on day one. Day two, 71 arrests. These are physical custody arrests. And a grand total for the 48-hour period of 158 physical custody arrests. And I want to let you know, because the question's always asked, in those cases, in those arrests, no use of force by our officers was necessary. I also want to break that down for you a little bit and let you know that of those arrests total, we had 10 of them that were felony arrests, 71 that were warrant arrests, and then there were 55 that were a combination of charges along with warrants. There was 22 other charges, as well as 57 for drug paraphernalia and charges. We had an average of 150 officers working in each day of those 2 days. And Marissa will be able to share those details with you after this press conference. For me, the main thing to report is the fact that our officers are working together. They're doing their job in a way that we had wanted them to. They're being conversational with individuals who are in that area, wanting to hear their needs, and also being responsive to requests for service and assistance. The other thing that has been brought up to us is the question about how, as we are operating in this area, are we affecting other areas? We are in regular communication with the other communities through their police agencies and their commanders, chiefs, as well as doing our own monitoring and based on reports of incidents that are taking place. We encourage the public that if you are having any problems and criminal activity in your area, that you report it to your local agency. All of the agencies are communicating, and if it's related to this operation, it's being considered, and we are providing resources as requested. And with that, I'll now turn the time over to Chief Brown.
Thank you, Commissioner. As the Commissioner pointed out, day two of our operation, we've been very tough on crime. Well over 150 arrests. But I want to reiterate, this operation has a very compassionate outreach component. Look, for those that are experiencing homelessness, it is not a crime. And based off of that, the social workers that have been working and staffing the CCC, along with those that are going into the field, have now provided service on day two to 12 individuals in the field. Real services, given to real people. 64 people have walked through the front door of the CCC, the Community Connection Center, and ask for and receive services. That's 76 total for day two. That number exceeds the arrest that we did yesterday. I think that's a distinct parallel that we should draw. And I want to say, look, these are numbers, but let me tell you a little bit about the story of the people that they're talking to. Yesterday, they came across a 27-year-old female who was 19 weeks pregnant. She was suffering from substance abuse disorder. She needed help badly. They were able to get her into a local area hospital where she is now receiving medical detox. Officers came across a male suffering from a staph infection. The staph infection has spread through his entire body. I checked today with those that were on scene, and they said he would have perished had they have not reached him and got him into a local service provider where he is now getting the treatment he needs. So, again, tough on crime, but with a compassionate outreach to those that truly need help. The Community Connection Center and the work we're doing down there as we're removing barriers and we're connecting people to services. Thank you.
Good afternoon. I'm Gary Edwards, Director of the Salt Lake County Health Department. Today was the first day of the Health Department and other partners, particularly Salt Lake City, in the cleanup efforts. This cleanup effort was no different than what we've been doing for months and even years in the area. It was a day earlier than our normally scheduled cleanup. And the difference is we will be doing cleanups on a daily basis in the Rio Grande area, and then even moving out further into the community as needs in the community warrant. As Chief Brown mentioned, our efforts are from a compassionate point of view. We have the responsibility to protect community and environmental health, and not just for the community at large, but for that specific community of homeless individuals. We want them to be safe. We want them to live as much as possible in a clean and in a healthy environment. And so our efforts are to protect the environment, to protect those individuals who are homeless, and then also to protect the broader community. We could not accomplish this without the support of our law enforcement agencies, and we appreciate Salt Lake City Police Department, Utah Highway Patrol for being there with us, and without Salt Lake City Public Works, these efforts wouldn't be possible. Thank you.
That's a good question. And we anticipated that. And built within this operation are the necessary components to do just exactly that. This operation, from the very start, has been Intel-led. And when people call and report this, and we encourage that, please report and let us know if you're seeing an uptick or a camp spring up or something like that. We need to know. And again, we can provide that outreach with the resources built into this program. So the more the public can give us, the better we can respond wherever it may go.
In fact, we have responded to some of those calls already and reached out into those neighborhoods and helped those who had kind of moved their camp to services and moved them back into what you are saying is where they can get the help that they really need. So some of that has already occurred, and we have been very responsive. I think our responses are same day, as a matter of fact, and so we'll continue to provide that level of service. Yeah, the number we're calling is 799-3686. You can also go online to slchost.org and report any issues that you're seeing in your neighborhood. And we are keeping track of all the emails and the phone calls and responding to those. We really want to make sure that we are tracking everything as much as possible. And if it all comes into the same locations, it works well for us on our end. But I don't know if the commissioner has another contact.
I don't have another contact right now. We always encourage, if it's outside of the Salt Lake area, for people to contact their local law enforcement agency. The main thing we wanted to make sure in this operation is that we were connected with all of the agencies in the state. And so really, it's that if it goes to your local agency, they know that they can contact us and will contact us, and we'll make sure that the information is shared back and forth. But as the mayor said and the chief said, the bottom line for us is being, if somebody's in need and they're in an outlying area, to be able to get those treatment resources available to them also. And so with the law enforcement agencies and officers, they can accompany individuals from the treatment side. You know, I have to give a lot of credit to Chief Brown and the Salt Lake City Police Department, because they have been in that area. They understand what those challenges are. And part of our plan was recognizing the fact that our troopers, as we brought them in, and our agents needed to be brought up to speed and paired with their officers. And so I think a lot of our planning and really just back and forth on identifying what issues we may encounter limited the amount of surprises that we've had. And so I never want to come across overconfident, but we really are seeming to make progress with our intended purpose.
Part of the thing is that we're processing the felonious conduct, and every person who has been arrested is being followed and tracked by our offices, both at the Salt Lake City Prosecutor's Office as well as the District Attorney's Office. So as we file those charges and we engage them in that process, we're still going to, those who are ripe for treatment that is currently available, we're going to process them just like normal. But this first wave really is identifying criminal behavior that we are actually aggressively prosecuting. So that's what we're focusing on right now. There's about 126 people who are related to some sort of a warrant, so we're processing those warrants out. And we filed multiple felonies already, and so we're just getting them into the system for the criminal prosecution. Then, as phase 2 has been articulated before, is going to really start looking at that treatment component. So right now, it's really focusing on that criminal element that's there, and what we can do in terms of getting them into the system and then holding them accountable. That's great. Salt Lake City, through Mayor Biskupski, made available a prosecutor for our city cases. We also have a team of prosecutors who are specifically assigned for the felonious conduct that would be filed from the District Attorney's Office. So we have actually 2 teams of people whose sole job is to just monitor that, both in terms of the number of cases that are coming in and also to see it through adjudication and then post-adjudication as well. So we have 2 teams in place from both of our respective offices that are going to be monitoring those very closely and actually meticulously following them all the way through the full process of the adjudication. So it's not like they're going to go to my other teams. They're actually going to be centralized with these 2 teams, one from the City Prosecutor's Office and one from the District Attorney's Office.
Yes, we do have a camping ordinance, and it is illegal to camp. There are some things, though, that have to preclude the arrest, as would be to give notice, give them time to pick up their stuff and move on, and also to check to make sure that there is some place they can be rather than right there camping. So if there is shelter available. No, I think this whole operation is designed to make that area, and particularly the shelter, safer. And so when we come across somebody that's camping, we should be able to say it is much different now. The shelters, that area is different. And so, and then to the health aspects, I mean, it's not safe to be camping outside. There's no restrooms. There's a public health risk to that also. So, but the officers, when we go out, you'll see officers go and talk with these folks, accompanied with social workers. So, it's not always a crime that solves the problem, or it's not always an arrest that solves the problem.
I think we can answer this together, but Lana Dalton, who runs the Community Connection Center, has been working with her state partners on really doing the outreach. That was a big piece of her program. And so when the chief said that we have social workers in the field with our teams, that's a reality. And we are doing the outreach beyond the Rio Grande Street and 500 West, that outreach has expanded. And as we take on phone calls of new camps, our social workers are going to those locations and helping people get the services they need and helping them understand the new dynamics in the Rio Grande neighborhood.
Thank you. I'm Scott Carver. I'm the Undersheriff, Salt Lake County Sheriff's Office, representing Sheriff Rivera. That question has come up quite a bit, and what I remind everyone is our first responsibility was to find 300 empty jail beds in our jail, and we did that with a combination of state and county money, and with partnering with some of the local county jails who were able to participate by contracting with us for some empty jail beds. As we go through the population of our jail, trying to find the pool of inmates that meet the criteria both for us to send out and for the other jail to receive, that pool becomes pretty small, actually, even with a total population of 2,100. The inmates in the CATS program generally fit the criteria. We recognize that that program, which is Correctional Addiction Treatment Services, we realize that that is a very valuable program. It is the very program that we are trying to get the Rio Grande people into. And so we and everyone else have a strong desire to keep that program whole and keep it effective. We are working with the treatment provider and the county jails participating to just move the treatment provider to the jail where the offenders are. So whether that be Salt Lake County Jail or Davis County Jail, as an example, the program will continue at its same numbers and same inmates being able to transition completely through the program.